Okay, good afternoon. I am Dr. Nidhi Sharma, IVF specialist, Medicover Fertility, Chandigarh. So today we are going to discuss what causes infertility and how to treat it. It's a very broad topic to be discussed in a live stream because what causes infertility? There are n number of reasons which can cause infertility. So first of all, we'll start with how and what is how we define infertility. So infertility is when a couple is unable to conceive even after 12 months of regular unprotected sexual intercourse. And then even then, if they are not able to conceive, then they fall under the category of infertility and they need further evaluation. However, as now the times have changed, people are getting married late. So, if the female partner is older than 35 years of age, then they need to get themselves evaluated after 6 months of regular unprotected intercourse. If they are not able to conceive, they should consult a doctor. So, how we broadly define the causes of infertility are first are what are the female factors and what are the male factors. As we know, when we are evaluating any infertile couple, we have to uh, evaluate both the partners as both male and female factors or the causes they coexist. So they have to go, the management, the treatment has to go side by side. So, if we talk about the female factors, what are the causes of infertility in females? So, it can be broadly categorized into two, three causes. First is the ovulatory causes. That is, there is some ovulatory dysfunction. There is some problem in egg formation, or the ovulation is not occurring properly. Patient is not having regular menses, then that can be first reason of infertility, and that can be one of the important causes of infertility. Then secondly, how the uterus is. If the patient is having some uterine factors, uterine abnormalities, some septa, some fibroids, certain kind of fibroids also they cause infertility. There are certain uterine factors. Then third is the tubal factor. As we know, for a normal conception to occur, the tubes should be patent because tubes are the place where the actual fertilization occurs. Once the egg is formed in the ovaries, it gets ovulated and it enters the fallopian tubes. And on the other hand, the sperms which are deposited in the vagina, they traverse through the uterine cavity and reach the fallopian tube and fertilize the egg. So, tube is a very important place for fertilization to occur and the early embryo formation to occur. So, the proper tubal function should be there, tube should be patent. So, another important causes of infertility in certain cases is tubal factor. The tubes are not functioning well. Then, fourth, another factor in females are the certain kind of tubal disease, peritoneal diseases or the pelvic diseases, some pelvic infections, some degree of endometriosis. This also hampered the tube and ovarian function. The relation between the tube and ovary is also hampered because of that. So that is other pelvic. It falls under the category of pelvic causes of infertility. So broadly in females, the causes of infertility are ovulatory dysfunction, tubal disease, peritoneal disease, some degree of endometriosis, and finally some other uterine factors. So these are the major causes of gross major causes of female infertility. When we come to the male partner, what all are the causes of infertility in males? First of all, many a times the patient who comes to us is comes up with an abnormal semen analysis report. So if the patient, the male partner is having some problems in the semen parameters, the sperm count is low or the sperm motility is less, or if we evaluate the semen sample, the sperm morphology is not up to the mark. So the most multitude of factors in male, they usually present as abnormal semen parameter report. So among male factors, there are many other. It starts from how the lifestyle is, obesity, um, certain chronic diseases, diabetes, chronic kidney diseases, certain other hormonal factors which can lead to sexual dysfunction, erectile dysfunctions, or many times patient have varicocele. There are multiple causes of having an abnormal semen parameter. Varicocele is what is the enlargement of veins around the testis, which causes the scrotal temperature to rise. As a result of which the number of sperms which are being formed in the testes they start falling. So varicocele is a very common cause of abnormal semen parameters. Then apart from that, certain very few cases there are certain chromosomal abnormalities and some genetic conditions where the sperm formation in the testis is hampered, and it leads to azoospermia or nil sperm count in the sample. So there are multiple reasons in male partner as well which can cause infertility. Broadly speaking, what happens is if we divide it by the percentage, how we categorize it, most commonly in 20 to 30% of the cases, male factor is the sole reason of infertility, whereas it contributes to 50% of the infertility cases overall. The male factor is an important contributor to the total, infertility patient pool. Then among the female factors, ovulatory dysfunctions, they are around 25 to 30% of the patients they come with in ovulatory dysfunction. The most common ovulatory dysfunction, which we see in our day-to-day clinical practice, is PCOD or the anovulation. What happens in PCOD? Due to some hormonal imbalance and there is some insulin resistance and increased androgens within the ovary, the ovulation does not occur on time. As a result of which, the menses are also delayed and the ovulation is also not happening. So the most commonly found cause of anovulation in especially young females is PCOD. So another cause of anovulation or some ovulatory dysfunction is hormonal imbalance, most commonly caused by thyroid impaired thyroid levels, hyperthyroidism or hypothyroidism, or there is some prolactin levels. If prolactin level is another hormone which causes anovulation, so there are certain tumors in the brain which causes prolactin levels to rise, leading to anovulation. So among the ovulatory disorder, PCOD is one major cause of infertility in patients whom we refer or we see on our day-to-day practice. Then apart from that, another major apart from the ovulatory dysfunction, another major cause of infertility on the patient, what kind of patients we see on our in our clinical practice, are the tubal diseases. Most common cause of tubal disease or the tubal blockage, especially in India, is genital tract tuberculosis or genital cox, which we call it as. So, as tuberculosis is very rampant in India, very prevalent, and it is almost endemic. So many of patients they don't present with classical pulmonary TB patients. They usually present with the complaint of infertility, that they are not being able to conceive. Rest everything is fine, but she is not able to conceive. So genital cox is one of the leading cause of tubal disease in our in a country like India. So, what tuberculosis causes? It causes it distorts the tube anatomy. It hampers the tubal lining, as a result of which the tubal function, the function of the tube is to make the bring the sperm and egg together, and so that they are able to the sperm is able to fertilize the egg. So the tubal function is impaired in tuberculosis patient. Many times there is tubal blockage, there are certain adhesions in the tube and around the tube near the ovary, as a result of which the tubal and ovarian relation is also distorted. So a lot of damage to the tubes occur because of genital tract tuberculosis, which is many a times patient is not aware of it. Patient is perfectly fine, but when we evaluate the tubes, then we come to know that there is some tubal blockage, and then we many a times uh, we evaluate her for tuberculosis. So that is very common, especially in a country like India. The tubal factor is another. Then third is endometriosis. You know, another important feature, clinical feature, which we see in our patients, are very prevalent among young patients. So, what is endometriosis? Endometriosis is like the is having some blood collection, blood contained cysts in the ovary, which are formed over the time. There are many theories of how endometriosis occurs and all, but ultimately there is some sort of blood containing cyst present in the ovary, can be present outside the ovary, around the uterus, around the tube. This also hampers the normal ovarian function. So the ovary has to make an egg, and so that is the egg is formed and it gets ruptured. But the endometriosis, it it reduces the it hampers the ovarian reserve, because this cyst is there. It is not letting the other eggs to grow around the ovary. So endometriosis is another reason for very common reason among young patients who come to us with infertility. And many a times there is treatment for endometriosis. There are certain injections, there are many things which we can offer to the patient for endometriosis. And IVF is also one very good way of treating such patients. And many times, surgical intervention is usually offered to the patient, but many times getting an IVF done is better than getting a surgical intervention done for endometriosis. So this is another one common cause of infertility in female. Then then I think if we come for other not very significant causes are the uterine causes. So in uterine causes, there are certain uterine abnormalities like uterine septa or bicornuate. Uterine septa is having some partition, or the septa sort of a a very thin muscular film-like structure present within the cavity. So it prevents the embryo which is formed to implant, and for if even if the embryo implants, it fails to grow further. So uterine septa is one such thing very commonly seen in fertile patient, and many times it is associated with recurrent miscarriages also. So uterine septa is one such thing. Then there are certain kind of fibroids. Not all fibroids cause infertility, but certain kind of fibroids, especially which are present near the uterine cavity or towards the inner aspect of the uterus, and it distorts the cavity where the pregnancy has to occur. So that cavities also get distorted with those certain kind of fibroids. So those fibroids also need to be like treated, and mostly it is usually treated with help of a surgery by hysteroscopy. But that kind of fibroids can also cause infertility. At times, fibroids are present near the tubal opening, where the tube opens into the uterus. Those are called cornual fibroids. So cornual fibroids can also um, lead to infertility, because they are causing tubal blockage. So such fibroids also need to be treated and operated upon, so that the tubal function is restored. Another common uterine causes, okay, another next. I don't think I'm getting any questions for the time being. Okay, so So I got a question from Anusha Ajay. Can ovarian reserve be improved naturally? Ovarian reserve can be improved. Okay, I mean, ovarian reserve is something which gradually reduces as the patient ages. And after 35 years of age, it has been found that the ovarian reserve falls drastically. So the capacity of ovarian capacity of making new follicle, new eggs in a ovary falls down after 35 age. There are certain things which are irreversible. That is one of the thing is the aging factor. As we are aging, the ovarian reserve is falling. This process cannot be reversed, but definitely, if we are planning IVF, we are planning to give you injections and make good oocytes. For that, yes, definitely, there are certain antioxidant. It has been found certain antioxidants have been found to improve the egg quality which we get after ovarian stimulation. So definitely then there are certain androgen, many studies which have shown that oral androgens, testosterone gels, they have also been found to improve the egg quality when we give them IVF stimulation. But as such, ovarian reserve naturally will not improve, because aging is such a process which cannot be reversed, be it ovaries, be it any of our body organs. When do we when do we recommend IVF treatment? Okay, there are certain conditions where we should refer a patient to an IVF specialist as soon as possible. First of all, first mainly is the in the as we discussed in the previous question, those who have a low ovarian reserve and who are older than 35 years of age. In those cases, there is usually okay, we can give them 1 or 2 cycles of ovulation induction if the married life is not that long. But if the ovarian reserve is less, age is higher, we should recommend the patient to an IVF specialist, and we should get an IVF done as early as possible, because IVF gives them the best chance of conceiving with their own eggs. So then secondly, certain endometriosis which I was discussing, if the endometriosis of grade 3 and grade 4, it means it is a pretty large endometriotic cyst which is there in either of the ovary or in both the ovaries, or when the endometriosis has distorted the uterine and the the tubal and the ovarian relation, and the tubes are also not working well, we have huge endometriomas there, it is also hampering our ovarian reserve. So in those cases, it's better to opt for IVF earlier. Then secondly, certain male factors, especially if there is azoospermia, where azoospermia obstructive time. I mean the sperms are being formed in the testes, but they are not there in the semen sample. In those cases, which we can offer the patient to undergo IVF so that we can retrieve those sperms from surgically from the testes, and we use them to fertilize the egg with the help of ICSI. So there are many conditions where we need to recommend IVF treatment to a patient earlier than usual. What is the most common cause? So Haritha is asking, what is the most common cause of infertility? Mostly, 50% of the cases, I think in females, most common is the ovulatory dysfunction, and among those causes, anovulation or the PCOD, which I had discussed, is the very common cause of infertility, and it can be very easily treated with the help of ovulation induction drugs, and especially PCOD, lifestyle changes, weight reduction, exercise, all these can help in overcoming these ovulatory dysfunctions. Most commonly, ovulatory dysfunction is is the cause of infertility. What is the right time to consult fertility specialist? Asked by Lavanya. Lavanya, I had told that if a couple is trying to conceive for the last 12 months and they are not able to conceive, they should consult a fertility specialist. And if the female is older than 35 years of age, she should consult after 6 months of trying of trying to conceive. Then another question is, working on laptop affects infertility in male? Yes, if you are like keeping your laptop for a long duration on your lap, actually what happens, the scrotal temperature is usually lower than the rest of our body temperature. It is physiologically like that. So yes, definitely, if you are using it for a very long time, it does affect the sperm count, sperm motility in the semen sample. And apart from that, if working and sitting for long hours, if you are sedentary lifestyle also affects fertility in males. So not only using laptop for a long time, but overall sedentary lifestyle, diet, no diet regulation, irregular sleep patterns, all these affect infertility and they cause infertility by hampering the semen parameters. Are there any natural way to enhance male fertility? Natural way. Okay. In natural way okay, if the we'll have to first of all see what is the reason of male infertility. If the male is having azoospermia, there are no sperms in the semen sample, then there is no way of treating it naturally. It has to be properly evaluated and treated according to the cause, what the cause is. If the semen parameters, okay, there are sperms in the semen sample, but the parameters are a bit deranged, the motility is there, is reduced, or the count is reduced, but not that too. Ideally, the count should be more than 15 million, and the motility should be, active motility should be more than 30%. So if the motility is like less than 30% and the count is like less than 15, but 10 to 15, or in those cases, definitely stop smoking, stop alcohol consumption, good lifestyle, as I have told you, good diet rich in antioxidants, multivitamins, all these factors, stress is the also one factor. These can help enhance or improve the parameters. But as such, we'll have, first of all, we'll have to see what is the cause of infertility and whether it can be treated naturally or it has to be treated like after proper evaluation with the help of certain medicines or some surgical intervention as well. So apart from that, good diet, good exercise, less stress, proper sleep patterns, all these things, they are helping in enhancing the natural fertility. Will lifestyle affect ovarian reserve? Yes, it has been seen. Especially, first of all, smoking is one factor which can reduce the ovarian reserve. Smoking, alcohol consumption, certain kind of drugs, certain if you are intake of too much of any kind of addiction of such kinds can hamper the ovarian reserve. So, if you are planning pregnancy, you are taking treatment for infertility, you should avoid these few things. These can definitely, prevent our ovarian reserve to falling any further. How many IUIs are recommended? There are many studies. First of all, I'll let you know what IUI, because I have not discussed IUI in this whole thing. In IUI is what in IUI we give ovulation induction to the patient. We make the egg. We give patient medicines, and after day 10 of the cycle, we start doing ultrasound and we see the egg is being formed or not. Once the egg is formed, we see it on ultrasound. We give them injections for ovulation, and after 36 hours of that injection, we do IUI. In IUI, we take the semen sample, prepare it, make it more refined, remove all the debris and extra cells. Only active motile sperms are there, and we place those sperms inside the uterine cavity. So this is a very simple way of, first and like initial step of infertility treatment, that is IUI. In IUI, what we are trespassing, we are just going through the cervix and placing the sperms in the uterus. Whereas in after a natural relation, the sperms are get deposited in the vagina. So we are just bypassing the cervical factor. Rest the tubes have to be functional. Egg should be well formed, should be ovulated, and our semen parameters should be good. So what we achieve in IUI is slightly higher than the natural conception. If the natural conception has 5 to 7% of chances of pregnancy in a particular month, IUI doubles it. IUI makes it 10 to 15, not more than that. That is the ideal. That is the best success rate which is quoted with IUI all over the world. So doing that again and again is usually not recommended. Many studies have done it to 6 cycles, many studies have done it to 9 or 12 cycles as well, but it has been found that usually we get the results in 3 to 4 cycles itself. Even after 3 cycles, IUI is not successful. It is usually not recommended to go any further because we are not going to gain much after 3 IUIs. What diet should be taken to improve infertility? To improve fertility. Okay, diet usually, if you ask, good diet in the form of protein rich diet, especially for vegetarians, milk products, dal, and green leafy vegetables, rich of vitamins, uh, minerals, good green leafy seasonal fruits which are there. All these are helpful in improving the fertility overall. But if a patient is having infertility, she has to get herself evaluated as well. A diet and exercise and everything goes hand by hand, but we need to find out first the reason, what the reason is of the infertility is. Diet can is additional to what all treatment we can offer to the patient, but good seasonal fruits, good diet, protein rich diet, not only diet, healthy lifestyle, exercise, meditation, healthy sleep patterns, all these things will help in overall help in improving the infertility. Or even if the patient is taking some treatment, if she is following all these things, the it has been found that the results they also get improved if she is taking all these things, taking all the precautions along with the treatment. So diet, good healthy diet, especially for vegetarians. What are the common tests to check male and female fertility rate? Test I have already discussed. Mainly for male, initial first and foremost is the semen analysis, which has to be done from a good center, preferably from an andrology lab, which is usually available any ART clinic, because it is usually done with the help is done by a very trained andrologist. So a good semen analysis from a trained andrologist first for male partner. For female partner, among the initial test, apart from the routine blood test, basic AMH test, which help us to know ovarian reserve, tubal patency, whether the tubes are patent, a simple transvaginal ultrasound to look for any uterine abnormality, and antral follicle to see the ovarian reserve. So TVS, AMH, tubal patency test. These are the 3-4 tests which a patient has to get done prime in the initial evaluation. And then all other further tests will depend upon how the initial reports are. And then further we evaluate. Medicover fertility is the best. Okay, thank you. Okay, thank you. Maxient Makaya, thank you very much. Okay. Kirtan, will diet affect fertility? Um, yes. If you are being evaluated for infertility, if you are undergoing treatment, if you are undergoing certain tests, definitely infertility, the results, the response to the treatment will improve if you are having good diet along with the treatment. Good diet includes healthy seasonal vegetable fruits and vegetables, protein rich diet if you are a vegetarian, especially milk products and dal and pulses. If you are non-vegetarian, you can continue with good non-vegetarian food, fish rich in omega amino acids and many other things. So definitely diet usually improves the overall, well-being of the patient as well as response to the treatment. But per se, diet only is not gonna help much if we are facing the problem of infertility. We need to get properly investigated and treated. What is the latest technology available to treat infertility? Hmm. Latest technology. There are many advancements being done. IVF per se now is not that latest, but if we see what all treatments are available, IVF still remain the ultimate treatment protocol for a patient. So in IVF also there are certain now new modalities to improve the success rates. Like ICSI is one such thing. ICSI is intracytoplasmic sperm injection, which we inject the sperm inside the oocyte. Then there is something called PICSI, which is a physiological ICSI in which the sperm which we use to fertilize the egg is also very carefully selected, which is physiological, which we believe is gonna help is gonna give us best embryos. So Pixie is another good new technology which is being introduced. Apart from that, there is laser hatching. Laser hatching is the embryos which are we are going to place it into the uterus. We the outer lining of that embryo is also thinned out with the help of a laser, which it will help the embryo to implant in the uterine cavity. Laser hatching is one thing. Then there is certain the modality called pre-implantation genetic testing, which will help us to know whether the embryo which we are going to implant is genetically or chromosomally normal or not. So there are many latest technologies which are available there, which are available to treat in IVF further. Then there are certain sperm selection techniques like microfluidics, which will help us to select the best sperm which we are going to use to fertilize the egg with. I need some flyers around IVF. Okay, Mr. Makaya, we'll share it with you. Our team will contact you. Otherwise, you can visit our website also. You can visit our website also. Okay, another very interesting question, I must say. Payal Viswas, will IVF baby born will be healthy? Yes, 100%. The first IVF baby was born in 1978. Uh, Louis Brown, as we call her. So that is, she was the first baby who was conceived after IVF, and she's since 1978, people are being born from IVF with the help of IVF, and over the years, so many studies have been done uh, on those babies whom we have conceived with IVF, and then ICSI also. If you know, I was discussing in the previous question, ICSI. In what ICSI we do, we take the sperm and inject into the oocyte. So there was some suspicion that we are injecting the oocyte, it might hamper the oocyte quality or the embryo because we are intervening. It may cause some chromosomal damage, some genetic problem. But over the years, long-term studies, longitudinal studies we have done, and we have found that the IVF babies are as healthy as a natural conception baby. And even long-term problems, long-term diseases, certain autism or many other things were evaluated, but it has been found that IVF is absolutely safe, and the baby will be usually is born healthy. The risk of carrying some genetic problem some chromosomal abnormality or any other structural defect, as we say, it is as good as any natural conception. So we get ultrasounds done, we get all the tests done on time. So the routine evaluation for any antenatal patient is as uh, is comparable to the IVF patient. So IVF is absolutely safe. Is okay. Is fertility is good for future life? I mean, I think you want to ask whether this infertility treatment is good for life. Okay. Frankly speaking, IVF as such is very safe modality. Over the years, there have been many modifications in the treatment of doing IVF. How it started in 1978 till 2023, the treatment has changed. The treatment protocols, the type of injections, they all have changed a lot. Have It has gone a drastic change, and it has become safer and safer for the patient, and it has been giving better results as previously. So over a long term if you're asking about long term effect of getting an IVF treatment or infertility treatment per se, it is very safe. It is very safe. Working on night shifts affects infertility. Okay, working night shifts. Definitely. I mean, if you are okay, night shifts. If you are always on a night shift, then the which we call it as circadian rhythm of the body gets upside down. So there is certain rhythm to the body, how our hormones work, how our, there are certain signals from the brain which go to the pituitary, which is again a gland in the brain, which releases certain hormones, which acts on our gonads, on the ovaries and the testes, and they lead to formation of sperms and eggs. So overall, if we are like working on night shifts, like continuously, it not only changes our sleep pattern, it affects our health overall. Be it our cardiac health, be it our pulmonary health, everything, diet or immunity. It hampers our immunity also. So definitely it has some effect on our fertility also, male or female. So having a good diet, good health, good normal sleep pattern is in in conceiving. So working on night shifts, if you're able to get adequate rest, if your sleep cycle is complete, then it won't affect much. But if like you are regularly on the night shift, then it's gonna affect. Nasreen Nasreen has asked, so what are the common causes of infertility? I think we have discussed it, I think twice in the previous video. There are multiple causes, male and female. So I should go to the next question. Organic diet improve infertility. Okay, it is a new fad of organic diet. Uh, if the eggs, sorry, the vegetables and the fruits, if they are of organic kind, they are overall, if they are gonna help. Overall, if you are getting good diet, be it organic or be it regular, if you are having good, your plate contains everything, good share of carbohydrates, good share of proteins, minerals, and everything, it's gonna help. So particularly organic thing is not gonna make much of a difference if your diet overall, your plate, your dinner plate or a lunch plate is complete in itself. It will be pretty good enough. So now it has been like, if it has been advertised so many times, certain organic diets, certain organic things which will help. But as such, scientifically speaking, if your diet is a good one, is a balanced one, it is gonna help you, be it organic or regular. Is it possible to conceive outside of the fertile window? Actually, there are many things which determine the fertile window. So if the body works in a different ways, I mean there is no particular way of assessing the fertility window. So there are certain tests which help us to determine the fertility window, but what exactly the fertility window is there in that particular cycle, nobody can predict. So it is possible to conceive outside the fertile window, because it probably for you it was a fertile window, for a body it was not the fertile window. Ovulation might have occurred 24 hours later, 48 hours later than the expected time. So yes, you can conceive outside the fertility window. Male fertility can be reversible. How do sperm count can be enhanced naturally? Yes, male fertility is reversible if treated properly, if managed properly, evaluated properly. Certain causes are definitely reversible, certain causes are not, which it will again a long discussion what are the causes reversible or irreversible. How do sperm count can be enhanced naturally? Yes, good diet, avoid alcohol, smoking, plenty of fruits, vegetables, exercise, good lifestyle. This is going to help improve sperm parameters if they are abnormal, but to some extent only. So, if you are having abnormal semen parameters, kindly get yourself checked, kindly get yourself evaluated. Not do not depend that certain kind of diet, certain kind of food is going to improve abnormal semen parameters. You have to get yourself evaluated. Diet can be additional to the treatment, cannot be the only treatment. Yes, I have discussed it before. Lifestyle does affect ovarian reserve. Female who smoke, alcohol consumption, certain kind of drug addiction, time, certain kind of drug addictions can also affect ovarian reserve. So avoid all that, especially if you are planning family, you're planning to have families soon. How unmarried women can test the ovarian reserve? It can be easily done with the help of a blood test called AMH. AMH is can give us an idea how the ovarian reserve is. You can get an ultrasound done. With the help of ultrasound, also we are able to evaluate how the uterus is, how the ovaries are. So unmarried women can also get those tests done. So very easily done. Last question. Okay. I think should do. Okay. Thank you for patient listening. And if you want any consultation, you can call us at the numbers given below. Thank you.